Prêt? Alors, bon après-midi tout le monde. Good afternoon, honorable members of the committee. I see a quorum, so first of all, I must inform you that the clerk of the committee, myself, can only receive motions for the election of the chair, and the clerk cannot receive any other types of motions, cannot entertain points of orders, nor participate in debate. And your first task, of course, pursuant to the standing orders of the House of Commons, is to elect a chair for this committee. Just a quick reminder, the standing orders also provide that the chair of this committee must belong to the governing party. Okay, so I'm now ready to receive motions. Je suis maintenant prêt à recevoir des motions pour la présidence.
I am now ready to receive motions.
Pawlowski.
Ron McKinnon.
So we have Mr. Pawlowski nominating Mr. McKinnon. Est-ce qu'il y a d'autres motions?
Are there any further motions?
Alors, plaît-il au comité d'adopter la motion? Oui, d'accord, agreed. Alors, je déclare la motion officiellement adoptée et
I declare the motion carried, and Mr. Ron McKinnon is duly elected chair of the committee.
invite à prendre le position.
I invite him to now take the chair right next to me.
The elections of the
And pursuant to the direction by the House, we need to, I guess, is it the will of the House to proceed to election of the vice chairs? Or the committee, I guess.
Well, thank you, Mr. Chair, and I will preside over the election of the two vice chairs, if it's the will of the committee. I'm now prepared to receive motion for the first vice chair. Of course, as a reminder, I would like to remind you that pursuant to the standing orders, that first vice chair must be a member belonging to the official opposition. Est-ce qu'il y a des motions à cet effet?
Are there any motions?
Kitchen.
I'd like to nominate Mr. Genereux.
Okay, so we have Mr. Kitchen nominating Mr. Genereux. Do we have any other further motions? Do you have any issue? No, okay. So therefore, having no other motions, is it the pleasure of the committee to adopt this motion?
Yes.
D'accord, agreed. Alors, I declare the motion carried, and Mr. Genereux duly elected first vice chair of this committee. Congratulations. Still pursuant to the standing orders, the second vice chair now must be a member of an opposition party other than the official opposition. Je suis maintenant prêt à recevoir des motions pour le second vice-président.
I am now prepared to receive a motion for the second vice chair.
Habituellement, c'est une autre personne.
Usually it's another member who nominates you.
Oui, Monsieur Weber.
Mr. Weber.
Who has sat in this committee for the last 4 years of the last Parliament, who's been a strong member of the Health Committee. I would nominate Don Davies.
So we have Mr. Weber nominating Mr. Don Davies. Are there any further nominations? Est-ce qu'il y a d'autres nominations pour le poste de...
Are there any further nominations for the position of second vice chair?
Il faudrait peut-être respecter.
Perhaps we should uphold the regular rules when it comes to nominating the vice chairs. The vice chairs are not usually part of the second opposition. It seems to me that the motion that was passed in the House was passed in order for when committees are formed under the usual rules. It seems to me that the position of vice chair is supposed to be granted to the second official opposition party. It would therefore be simpler for a proposal in that direction. Otherwise, I think that there are discussions happening between various parties about the issue of the third opposition. The NDP would like a third vice chair. I think that that's a discussion happening at the Procedure Committee. Discussions have already started with the various leaders of the various parties. to manage the impasse, perhaps someone could uphold the regular rules and nominate me. I regret having to intervene in this way. I thought that the rules were clear.
According to standing orders, there is a provision, there is no specification about, which secondary opposition party is vice chair. But if it is the will of the committee to entertain motions for the two different parties, we can proceed in that way. Is there a motion? Is that Mr. Jenner?
Yes, in the spirit of, as I understand, it goes to secret ballot after that for a second vice chair. As we know, according to Standing Order 106.2, that we only have two vice chairs, so that's something you have to take obviously up at PROC. But in accordance with Mr. Theroux' request, I'll nominate him as a vice chair also.
So we have also Mr. Generou that just nominated Mr. Thériault. Are there any further motions? No? So...
Do we not?
This needs to be... would be able to...
No, that's fine.
Okay. Since there are more than one candidate nominated for the position of second vice chair, it's our duty to proceed by secret ballot pursuant to the standing orders of the House of Commons. Before proceeding, I will very briefly explain to you the process. My colleague Alexandre Roger, who is also a procedural clerk at the House of Commons, will distribute a ballot to each member of the committee. Vous devez clairement inscrire sur ce bulletin de voix,
You have to clearly write your choice by writing the first and last name of the candidate on the ballot and deposit it in the box. We will then count the votes. And I will announce the name of the successful candidate. If no candidate receives a majority of the votes, another ballot will have to be conducted in the same manner.
ballots. Allow me to repeat the names of the candidate nominated. So we have Mr. Davies and also Mr. Thériault. So wish you a good vote. Mr. Chair, one candidate has won. Je déclare que M. Thériault a été opté.
I declare Monsieur Thériault has won the vote. I officially declare him officially elected second vice chair of the committee.
Mr. Fisher.
Mr. Chair, if it would be deemed appropriate, I have a handful of routine motions here that I would like to move individually for the
Please.
committees.
Go ahead.
All right. Sorry? Yeah. I'll move them individually, but is there a way, I'll ask the clerk if there's a way to move the package as is, or should I move them all individually? Oh, yes, right.
Copies to everyone?
That's what I mean, the package.
Copies.
So in order to vote these as a block, we need unanimous consent by the committee.
I'm happy to move them individually.
Does the committee give unanimous consent to pass these as a block?
Mr. Chair? No, I would request they be moved individually.
Fair enough.
I can do it.
Okay.
All right. As that pertains to analysts, that the committee retain, as needed, and at the discretion of the chair, the services of one or more analysts from the Library of Parliament to assist in its work.
All in favor?
Aye.
Opposed? Carried.
With regards to Subcommittee on Agenda and Procedure, that the Subcommittee on Agenda and Procedure be established and be composed of 5 members. The chair, 1 member from each party, and that the subcommittee work in the spirit of collaboration.
Could we ask the analysts actually to join us here? Thank you. Any discussion? All in favor?
Aye.
Opposed? Carried.
With regards to reduced quorum, that the chair be authorized to hold meetings to receive evidence and to have that evidence printed when a quorum is not present, provided that at least 4 members are present, including 1 member of the opposition and 1 member of the government, but when traveling outside the parliamentary precinct, that the meeting begin after 15 minutes regardless of members present.
Any discussion? Mr. Davies.
Mr. Chair, I'm going to move an amendment to this, to the reduced quorum requirement that I think is just more reflective of the minority parliament we're in and the reflection of the parties that we have around the table. And I'll explain it before I move it. But essentially, it's to keep it exactly as it is. But instead of having 1 member of the government and 1 member of the opposition required for quorum, to have 2 members of the government and 2 members of the opposition. So that would be my. I'll move that amendment and be happy to speak to it if any members would like me to.
Is there any discussion on the amendment?
Perhaps, Don, you could give us an explanation as your thoughts on that.
Sure. Well, there's 4 parties around the table now, and so as opposed to when there's usually 3. So in order to have a quorum last time, it was 1 member from the government, 1 member from the opposition, and then it could be anybody else who was there. I'm concerned that that it has to do with the ability of a meeting to be ended. And I think it should require 2 members of government and 2 members of opposition to be present, so that we reduce the ability of a meeting to be ended simply by the evacuation of of 1 party. The fact there's 3 parties over here, I think, is a better internal guarantee that you have 2 people from you have a member from more than 1 party present, as a possibility to keep the meeting going.
Any further discussion?
Oui, Monsieur le Président.
Yes, Mr. Chair. Perhaps the clerk could provide this answer for me. How many times has this particular provision been used over the last several years?
Ce que j'ai cru remarquer.
Because I thought I had noticed that this quorum issue came up as a proposal during other legislatures for other committees. It's been used many times?
Juste pour mon information.
Just for my own information.
Mr. Chair, if I might, this isn't about committee quorum. This is about reduce quorum. So I'm happy to be collaborative, but I don't think that it's as big. You still want to stick with the 2 and 2 with reduced quorum numbers?
Yeah, I'd like to move that.
Alors, Monsieur Thériault, je mentionnais.
Mr. Thériault, I mentioned to the newly elected president, Mr. McKinnon, it was identical to what was passed during the previous legislature. However, for historical purposes, for your information and that of the committee, during the last minority parliament, which was the third session of the 40th legislature, this motion said that the reduced quorum included at least 3 members of the committee, including at least 1 member of the opposition. Instead of having 1 member of the government and 1 of the opposition, the reduced quorum allowed for 3 members, including 1 from the official opposition. Was it used? In what sense? Was it put into practice? How many times? That's a good question. I'm afraid I don't have the answer. Just based on your own memory? I would say during the last 2 parliaments, it was rarely used. Usually we always had full quorum.
Rarement utilisé.
It was used rarely during the last 2 legislatures.
I'm not sure of the significance of this change. However, I think there is some significance in the fact that we start off on a cooperative note, because I think it's important if our committee is going to function well that we try to cooperate in things. So in my mind, I'm happy to go along with your motion if it's significant to you.
Mr. General.
Thank you, Mr. Chair. Happy to go through these routine proceedings. I'm hoping that they're relatively quick because we do have officials here looking to be briefed. And just to refer you, Mr. Chair, to the unanimous consent motion where it says, following the election of the chair and vice chairs, the committee shall proceed to a briefing from officials. So the routine proceedings, although be it helpful, if this is going to continue like this, I'd rather just get to the officials who have spent valuable time coming here today.
I appreciate that. However, we do have to have certain process in place before we can actually conduct the meeting.
It's outlined in law, so. So do we need to vote on that?
So any more discussion? So a vote on the amendment. All in favor? All opposed? Carried.
Thank you, Mr. Chair. I'll move along more quickly. That witnesses, with regards to questioning of witnesses, that witnesses be given 10 minutes for their opening statement, that at the discretion of the chair, during the questioning of witnesses, there be Yes. Oh, we only voted on the amendment.
So is there any discussion on the reduced quorum motion as amended? All in favor? Opposed? Carried. Okay.
Okay. That witnesses be given 10 minutes for their opening statement, that at the discretion of the chair, during the questioning of witnesses, there be allocated 6 minutes for the first questioner of each party as follows. Round 1, Conservative Party, Liberal Party, Bloc Québécois, New Democratic Party. For the second and subsequent rounds, the order and time for questions be as follows. Conservative Party, 5, and that thereafter 5. Liberal Party, 5. Conservative Party, 5. Liberal Party, 5. Bloc Québécois, 2.5. New Democratic Party, 2.5.
Any discussion? All in favor? Opposed? Carried.
With regards to documents distribution, that the clerk of the committee be authorized to distribute documents to members of the committee only when the documents are available in both official languages, and that witnesses be advised accordingly.
Okay, any discussion? All in favor? Opposed? Carried.
That the clerk of the committee be authorized to make the necessary arrangements to provide working meals for the committee and its subcommittees.
Any discussion? All in favor? Opposed? Carried.
Thank you, Mr. Chair. That if requested, reasonable travel accommodation and living expenses be reimbursed to witnesses not exceeding 2 representatives per organization, provided that in exceptional circumstances, payment for more representatives be made at the discretion of the chair.
Any discussion? All in favor? Opposed? Carried.
That unless otherwise ordered, each committee member be allowed to have one staff member at an in-camera meeting, and that one additional person from each House officer's office be allowed to be present.
Any discussion? All in favor? All opposed? Carried.
That one copy of the transcript of each in-camera meeting be kept in the committee clerk's office for consultation by members of the committee or by their staff.
Any discussion? All in favor? Opposed? Carried.
And finally, Mr. Chair, with regard to notice of motions, that a 48 hours notice, interpreted as 2 nights, shall be required for any substantive motion to be considered by the committee unless the substantive motion relates directly to business then under consideration, provided that 1, the notice be filed with the clerk of the committee no later than 4 p.m. from Monday to Friday, that 2, the motion be distributed to members in both official languages by the clerk on the same day the said notice was transmitted, if it was received no later than the deadline hour, and that 3, notices received after the deadline hour or on non-business days be deemed to have been received during the next business day, and that when the committee is traveling on official business, no substantive motions may be moved.
Any discussion? All in favor? Opposed? Carried. Thank you, everybody.
Yeah, I wanted to tell you if you can contact the committee about the ticket. Suspension, so you have Ms. CD first.
Okay,
And-
Ms. Sue.
Mr. Chair, I would like to suggest that the committee agree that we continue our briefing next week, Monday and Wednesday. Some witnesses like President of CBSA, Public Safety, Global Affairs Canada, and Transport Canada. We can continue this briefing discussion.
Okay, thank you. I think we'll defer that for just a moment. I'm going to ask if it's the will of the committee to be in a televised session by the House of Commons.
Point of
video.
order, Mr. Chair, if I may. I have further amendments to the standing orders, or to the routine. We're not finished that yet. I have
Okay,
3 other motions.
I apologize.
Thank you.
Karen?
Are we still on
Chair.
that order of business? Thank you.
Point of order, Mr. Chair. We're already 45 minutes into this, and it says we entertain the routine proceedings so we could get a structure of today's meeting. However, it does say that the committee shall proceed to a briefing from officials on the Canada response to the outbreak of the coronavirus immediately following the election of the chair and vice chair. So I would suggest you perhaps revisiting Mr. Davies' motion at later dates, so we have officials here that I do think that we need to hear from immediately.
Mr. Davies.
Well, actually, with great respect to Mr. Genero's comments, it is the standard practice of all committees to immediately proceed to adoption of routine proceedings and immediately after the election of the chair and vice chair, and it's never put on the agenda. It is and I think the clerk will confirm that. If we ask that. So it's not literally taken on the agenda. That is automatically what the committee has to do, and we're not really able to be fully functional and able to proceed until we have our rules of engagement voted on. So that's why it's not on the agenda, and that's why it's perfectly in order to continue.
Mr. Polonsky.
Can I make a request then? Yeah, okay, but let's do it really quickly because I agree with Matt in terms of we're here. This is an urgent situation. The epidemic, at least internationally, is certainly of significance, and I think we want to deal with this issue and start dealing with it today, not be bogged down in procedure for a day, 2 days.
Mr. Jenner.
Obviously agree. But I would like to, if it requires a motion to go directly to bringing the officials in and perhaps deferring this to the end of our meeting to go through the remainder. I believe you would agree, Mr. Chair, that we have the necessary structure in place to go forward with the questioning. And I think this is an unusual and special instance with having these officials here today, and really don't want to waste any more of their time and move right directly to a line of questioning. So happy to move a motion if that's what's required, but would hope that there be a friendly amendment and we can just have the officials entertain.
I think Mr. Davies has precedence here for his motion. I will let us hear the motions, please.
I have. There are several items that were in the standing orders from last Parliament that I don't think will be controversial, and one other matter that just governs the in-camera proceedings. But I'm happy to, if it is the will of the committee, to revisit these issues at our next meeting. If that's the will of the committee, then I'm happy to do that, on the understanding that we don't consider the full standing orders of this committee fully closed until we've had a chance to fully consider all of them.
Is that okay with everyone? Okay, that's what we'll do. So back to the matter of being televised. Is it the will of the committee to allow this meeting henceforth be televised? Okay.
Okay, so please suspend the meeting.
And we're going to suspend the meeting and ask the witnesses to come forward.
Chair, I want to confirm, I would like to suggest the committee agree that we continue our briefing next week on Monday and Wednesday with the witnesses. If opposition want to bring any witnesses, they can, send to the clerk. As I said, President CBSA, Public Safety, Global Affair Canada, Foreign Affairs, Transport Canada, and IRCC, Defence. So I want to confirm that we continue. It's important discussion.
So the order of the House in which we are now operating was to hear one briefing, and I believe Ms. Sadhu's suggestion is that we extend the briefings into next week, and she has proposed a number of witnesses and certainly invited the opposition to submit witnesses as well. With the understanding, I expect that the clerk will make whatever arrangements can be done to bring them together for the meeting. Is it the will of the committee to proceed in this way? All in favor? Okay, it shall be done. Okay, so we have today before us, we have Mr. Stephen Lucas, Deputy Minister. Welcome. We have from the Public Health Agency of Canada, Tina, and I apologize, Tina Namisnowski, President, and Dr. Teresa Tam, Chief Public Health Officer. Welcome. I believe the Deputy Minister does not have a statement, but the Public Health Agency has a 7-minute statement. Please proceed.
Should I touch that? Oh, there we go. Thank you, Mr. Chair. Thank you for the opportunity to address the Standing Committee on Health regarding the Public Health Agency of Canada's efforts to prepare for and respond to the arrival of the novel coronavirus in Canada. I'm here today with Dr. Teresa Tam, Canada's Chief Public Health Officer, and Dr. Stephen Lucas, the Deputy Minister for Health Canada. Présentement, notre objectif, c'est le limiter les répercussions du virus et contrôler sa propagation.
Currently, our objective is isolation to control the consequences of the virus and limit its propagation. That includes successful detection and management of cases, my microphone is on. Can you hear me?
Start over.
So, thank you, Mr. Chair, and thank you for the opportunity to address the Standing Committee on Health regarding the Public Health Agency of Canada's efforts to prepare for and respond to the arrival of the novel coronavirus in Canada. I'm here today with Dr. Teresa Tam, Canada's Chief Public Health Officer, and Dr. Stephen Lucas, Deputy Minister, Health Canada. Présentement, notre objectif, c'est le confinement.
Currently, our objective is isolation to limit the consequences of the virus and to control its propagation. That includes the successful detection and management of existing cases, as well as managing disinformation to reduce fear. Consistency is the key of our approach at the federal, provincial, and municipal levels. Cooperation is absolutely imperative. The current response to cases of the virus in Canada reveal a high level of intergovernmental coordination. That means that the system is working as expected.
Mr. Chair, we have learned a lot, not only from SARS, but also from the H1N1 pandemic, and most recently, the Ebola outbreak in the Democratic Republic of Congo. There have been key improvements that have been made in Canada with respect to our capacity to respond to these types of situations. We've had the creation of the Public Health Agency of Canada to provide clear leadership federally during a response. We have enhanced federal, provincial, territorial collaboration through a formal network of public health experts led by Dr. Tam, which is called the Public Health Network of Council. We also have a Chief Public Health Officer whose role was born out of the SARS experience to ensure an authoritative voice to all Canadians during a public health event, which is essential. I think, as everybody knows, the situation in Canada is evolving as it is around the world. Since the initial identification of a cluster of cases in Wuhan, China in late December, there are now over 6,000 confirmed cases of the new coronavirus in 31 provinces in China, including 133 deaths. 99% of the cases are in China, with the majority being in Wuhan. Closer to home, within the United States, there are 5 confirmed cases, and in Canada, 3, 2 in Ontario and 1 in British Columbia. So we do expect that the number of confirmed cases in China and other countries will continue to rise as monitoring efforts continue to increase and more individuals present themselves to health providers with symptoms and are diagnosed. It's not unexpected for us to have travel-related cases in Canada. The health system has been on alert since we first heard of the outbreak in China at the end of December, and it's remained vigilant to detect potential cases and respond as quickly as possible as soon as they are recognized. So where are we, from a federal perspective, focusing our efforts? In terms of border measures, at the 3 airports that accept direct flights from China, Toronto, Vancouver, and Montreal, we now have information on screens in the customs hall in French, English, and simplified Chinese that tell individuals to self-identify to a border services agent if they are experiencing the novel coronavirus symptoms. We have a health screening question that's been added to the electronic kiosks at all of those 3 airports, asking travelers if they've been to Wuhan. And as of today, this question will reference the whole of Hubei province. And by the end of the week, we will have more public health staff deployed in airports to complement CBSA screening in customs halls and to provide information about what individuals should do if they experience any symptoms. We've been working very hard to mobilize the public health system across the country. And the Public Health Agency is regularly convening provincial territorial counterparts to share information and diagnostic capacity and to develop guidance for a health response under the leadership of Dr. Tam. We've had significant engagement with provinces and territories, since at the end of the day, they are the frontline response that's very much involved in dealing with cases on the ground. We now have a federal, provincial, territorial special advisory committee that's been struck, focused exclusively on the novel coronavirus. And the Minister of Health is also engaging with her PT counterparts to discuss collective readiness and encourage collaboration. And of course, we're working very closely with international partners, including the World Health Organization, as well as the Center for Disease Control in the United States. In terms of monitoring and reporting, monitoring illness due to the novel coronavirus is essential to containing its spread. We are working closely with provinces and territories and the World Health Organization to track the spread of the virus. And our National Microbiology Laboratory in Winnipeg has the test for the novel virus and is working collaboratively with provinces and territories to increase testing capacity across the country. Our lab in Winnipeg is also a reference lab, which is confirming provincial territorial test results, given this is a new virus. And Canada, of course, is obligated under the international health regulations to report confirmed cases of coronavirus to the World Health Organization. After a case is confirmed, focus shifts to contact tracing to determine if others have been infected. Contact tracing is led by local public health authorities in collaboration with provincial and federal agencies, such as Federal Border and Quarantine Services, airlines, and public health agencies in other countries. Ontario and the cases in Ontario and British Columbia were managed using appropriate infection prevention and control measures. In terms of research and vaccines, we have been working internationally in terms of mobilizing an international response or contributing to the mobilization of an international response. And through global affairs investments, Canada is funding a global alliance called Coalition for Epidemic Preparedness Innovations that's coordinating early international efforts for vaccine development. And we're working with existing partners to pursue research studies to characterize the virus, develop animal models, and explore candidate vaccines that can contribute to the international vaccine development efforts. Sur le sujet de communication, il faut assurer une approche.
When it comes to communications, it's essential to have a proactive approach in order to reassure all Canadians and to provide regular updates in a transparent way to counter disinformation. This is an essential lesson that was learned after our experience with SARS, which created a situation in which certain communities and Chinese individuals were victims of racism and racial profiling. The issue must be tackled from the very beginning. A large part of our efforts are dedicated to countermeasures to messages that could be disseminated by social media.
Our colleague, the Deputy Chief Public Health Officer of Canada, Dr. Howard New, are also engaging regularly with the media through technical updates. And we're providing advice to Canadian travelers through travel.gc.ca to help them make informed choices about traveling to China and elsewhere, and to help reduce the risk of getting sick and the steps to take if they exhibit symptoms associated with coronavirus. We also now have a 1-800 line that Canadians can call to get information about the coronavirus. And Dr. Tam is also undertaking outreach to national health professional organizations, and there's regular communication with federal workers and federally regulated employers with information on occupational health and safety in terms of this particular virus. As I mentioned, we have a corona information line that's now live for Canadians that provides answers to specific questions. And we've been engaging with other stakeholders such as air carriers to ensure that they understand their role pursuant to the Quarantine Act about notifying us in the event that they have a sick traveler on their conveyance prior to their arrival in Canada, so that we're able to deal with that effectively once a person touches down and reaches our shores. And of course, they're interested as well about the protection of their own staff. So, finalement, j'aimerais remercier la commission.
Finally, I would like to thank the Standing Committee on Health for taking the time to review the coronavirus situation, which continues to change. The Public Health Agency is closely monitoring the situation and is constantly evaluating the risk it represents for Canadians.
Noted already, working very hard with our partners, and we will continue that on the way forward. Mr. Chair, we'd be very pleased to answer your questions. Thank you.
Thank you, Ms. Nowinski. Give me time, it'll work. Oh, anyway. So the first question is to the Conservatives. Monsieur General.
Point of order?
Yes?
I'm not sure who to ask what question. It would seem to me, in my mind, to make sense. Or do we want to ask each witness the bunch of questions? Because I don't think we're going to have time, but I think we want to ask questions to all of them. Would it, given the limited time, would it make more sense to let everyone speak and then get our questions in? I just want to get in questions.
So the procedure is that we each everybody gets a time slot. You have 6 minutes next, and you ask those questions to whomever you like. The witnesses have 10 minutes per organization to give a presentation. I erroneously said 7, but I gave you 10. And Mr. Lucas is not presenting. So we've heard from the witnesses, and now we hear from the questions. And Mr. General.
And just a quick, I guess, procedural thing to answer my friend, Mr. Pawlowski. The standing, the unanimous consent motion that was passed in the House doesn't have an end time. I recognize the agenda today does of 5:30. However, there was no end time, and the unanimous consent motion supersedes the agenda. So we'll proceed under that, and hopefully everybody will be able to have enough time to ask and answer their questions. I'll proceed to my questions now. Hopefully that didn't take up much of my time there, Mr. Chair. The Prime Minister said today, with regards to the first flight that came in from China, that there were a number of individuals who they were trying to follow up with and contact. I think our purpose on the official opposition of calling this committee is to certainly make sure that Canadians have as much information as possible. The public safety of Canadians is the utmost importance of everybody, I feel, within the House of Commons. When he made those comments today, I think probably some flags were raised across the country, wondering what's the percentage of those people that we've been able to contact. Where are those people? Hoping perhaps able to shed some light on how many people were on that flight to begin with, and also how many people have we been able to follow up with since that flight.
Mr. Chair, so I think pursuant to the comment that I made during my opening statement, contact tracing is something that the local provincial health authority within the jurisdiction that has the individual that they're dealing with, it falls within their responsibility. Now, that said, we've been working very hard with the province of Ontario to support their efforts in terms of identifying individuals that were on the plane associated with the first index case in Canada. At this point, it's our understanding that if they haven't contacted 100% of the people that were in the surrounding area around that index case, it's about 99.9%. I think unless my colleague, the Deputy Minister from Health, has anything to add to that, that's our understanding at this point in time.
Do they report that information back to you, through you? I would suspect, as the president of the Public Health Agency of Canada, you'd be interested in how many people would still be out there. Is that information that's sent to your agency?
So in terms of the role that the province plays, they are the ones that are responsible for the case management of the individual. So we support them in terms of helping to find where those individuals might be and how to get a hold of them. But in terms of reporting back to us on, who those individuals are, there's no obligation for them to do that.
Okay, interesting.
They do, sorry, Mr. Chair, I mean, obviously, in terms of any kind of confirmed case or a suspected case, we are certainly working very closely with the provinces and territories, and they definitely report that to us.
The minister had said just this afternoon that the plan is to repatriate Canadians stuck in China, and has said that they have secured a plane. As of now, there's 160 people, I believe, who have asked for help, 250 in China. If the government is successful in getting these individuals home, what's the plan once they arrive here in Canada?
So we're working very closely with our colleagues at the Global Affairs Canada, who are leading that particular initiative. And I think, as our minister had indicated, that would include, how it is we will assess and deal with people when they return to Canada. So that work is underway.
Okay. So certainly we'll support the motion to get the foreign affairs officials here as well. The minister said that they'd be quarantined once they arrive. I suspect that then falls within your jurisdiction, does it?
So we have responsibility for the administration of the Quarantine Act. And we're working closely, as I said, with our colleagues at Global Affairs Canada, as well as others, in terms of coming up what we think is the best approach in terms of dealing with individuals when they return to Canada. And I think, as our minister highlighted today, we're all very much concerned with ensuring the health and safety of Canadians, as well as those Canadians that would be returning to Canada on that plane.
So I guess help me understand it then. Do we check them prior to them leaving the China, or are they checked once they land still? And then in terms of quarantining, are they quarantined at a hospital? Are they quarantined at home? What's the process going forward?
So, Mr. Chair, we're working through all those details at this point in time. So it's premature for me to actually pronounce on that, because we've yet to conclude the way in which we're going to operationalize the return of the flight. But we're working through that as quickly as possible. Yeah, but it's safe to say that we're very much attuned to ensuring that we're doing the requisite public safety. So
is there not a protocol, though, that would be in place? Is there not a standard that would be a usual practice of some sort if somebody is to be quarantined? I don't know. I would be concerned if we just don't have a plan once they land. Then why are we sending the plane over there? Perhaps you could shed some light on that.
So we definitely, through the Quarantine Act, the Quarantine Act is focused on preventing the introduction and spread of communicable diseases, and that Quarantine Act applies at all ports of entry. And pursuant to that act, we definitely have the authority to, take measures that would help us ensure that the health and safety of individuals that are coming home to Canada is dealt with appropriately. So for sure, we are working through all of the details that will ensure that we are fully aligning with the obligations of the Quarantine Act.
Thank you, Mr. General. So next is Dr. Pawlowski. You have 6 minutes.
I know different countries are responding in a different fashion to this outbreak, and I'm not sure who I should be addressing this question to. But when you look at that map of China and where their cases, it started off around Wuhan, and if you look day to day, I think I saw day to day, it was a little red blop where you had cases. The next day it was bigger, the next day it's bigger, and now it's looking like a lot of China. The BBC was reporting today that their Ministry of Health we're asking people to voluntarily all people coming from China to voluntarily self-isolate for 2 weeks on returning to the country. I think because the idea is it got out of Wuhan. If you look at the numbers and what's happening in China, it's not just isolated to Wuhan. It would seem to me a fairly feasible thing for us to do and a precautious thing to do, that anyone coming from China self-isolate for 2 weeks. Have you considered making that recommendation and potentially under the Quarantine Act? I don't know if there's a means to enforce that.
Answer?
So right now, we have protocols in place together with the province and territories on isolating cases and certainly doing rigorous contact tracing and monitoring. That's the key to preventing any spread from a case in Canada. So that, I think, is the primary importance. So I think for other completely asymptomatic people, currently there's no evidence that you should be essentially quarantining of them. I think what you're proposing is a sort of voluntary self measure, but I would say that as our president of the Public Health Agency has said, is that you have to be very cognizant that the global effort to contain the virus requires the absolute commitment and engagement of the communities that are affected. Otherwise, they'll be stigmatized. They will be asked to be doing measures that are beyond what is currently the sort of public health evidence. So it is a massive balance when you're restricting someone's freedom, essentially, to be moving about in the community after return. So I think that is not something that we would take lightly.
Let me say, and this is maybe an added question, is that the Chinese authorities, my understanding at least is reported in the New York Times, I think Mr. Ma, they're reporting that they think that the disease is communicable during the incubation period, meaning when people are asymptomatic, it can be transmitted. I understand that that hasn't been confirmed. Other agencies like the CDC have questioned whether that's really the case, but I think the foremost authorities on the novel coronavirus are going to be the Chinese. So if they figure it's that way, Britain has already taken action in terms of voluntary coordination. It would seem to me something that maybe we ought to consider. I don't know how drastic that is. I was under quarantine under SARS-2, when I saw someone who supposedly, when SARS was over, someone who turned out to have SARS without any precautions. I put myself in quarantine figuring, I know he's got SARS, and sure enough, he did, but it took about 6 or 7 days for the Public Health Agency to report that to me. But I don't know if that's asking too much, given the possibility to ask people to voluntarily quarantine. And if the British are doing it, I would suggest we ought to think about it.
So I know that the World Health Organization is actively in China looking at the evidence. So that is a very key piece of evidence that we're trying to ascertain. But we do know something about coronaviruses, given that we've had other coronaviruses that cause anything from a mild illness, the sort of common cold, all the way to a more severe end of the spectrum, such as the SARS coronavirus and the MERS, or Middle East Respiratory Syndrome coronavirus. So based on what we know about those coronaviruses, is it possible that an asymptomatic person could transmit the virus? Even if it's possible, it is, we believe, a rare event. And it is not that type of transmission that drives the force of an epidemic. So I think we have to be reasonable in our public measures and just balance out the risks and benefits in terms of the impacts that are not simply health, but psychological, other health impacts, as well as non-health impacts, being societal and economic as well. So I think it is not something that it's something that we're pursuing very actively with the World Health Organization, and they know they have to get to the bottom of this. But we do know that even people with mild symptoms don't transmit very readily. Could they possibly? but that's not what drives a actual epidemic.
Okay, you brought up the World Health Organization. So in response to SARS, that was the impetus for the creation of the new international health regulations, which set up a mechanism for monitoring for outbreaks of infectious disease, a mechanism for reporting for WHO, and then if it's considered something that could potentially be a public health emergency of international concern, convening a committee to make the decision whether to call it a public health emergency of international concern. I understand you've been in contact with WHO. This would certainly seem to be a public health emergency of international concern. We were meeting on as a caucus on a Sunday to consider this as front page on every newspaper in the world. Why hasn't that been declared?
If the witnesses have a quick answer to that, please go ahead.
I know that the committee is meeting tomorrow morning, so I think we need to await the actual deliberations. The final decisions up to the Director General of the World Health Organization.
Thank you. We go now to the bloc. Monsieur Thuriot.
Merci beaucoup, Monsieur le Président.
Thank you very much, Mr. Chair. Before starting, please permit me to tell the translation team that they're doing exceptional work. I've been listening to them since the beginning. They usually do remarkable work, and I just wanted to thank them for their work today. I will try to speak more slowly to help everyone understand. Dr. Tam and Ms. Yaminovsky, I hope I pronounced that right, said that we had to counter disinformation. I understand that to mean that we have to continue disseminating correct information. In what we have to counter, given what we have to understand today, we need to make sure that this epidemic does not become a pandemic. Is it still true at this time that in Canada, and perhaps outside of China, there is no case that is the result of secondary contamination?
So, as our president just said early on, 99% of the cases are in China. So, of the cases that are related to travel to affected areas in China, there's been, I think, about 3 instances of human-to-human transmission in a very limited way amongst close contacts. But every country who's had the imported cases, if you like, is very much monitoring all the close contacts to make sure that they don't actually spread further into the community. But all the evidence related to the exported cases show that they continue to be in close contacts of the case.
En fait, ce que je voulais dire, c'est...
What I meant to say is that, is it not true that right now, people who have been detected are people who were in direct contact, and they have a connection to China, the site of the epidemic, and that in Canada, for example, the cases we have are the ones of people who arrived from there where the epidemic is happening, and that currently we have no contamination coming from one Canadian to another Canadian who never went to China. Is that not true for other countries? People were contaminated over there. They come back perhaps in an asymptomatic state before symptoms manifest. I was just wondering what you had to say about that.
So in Canada, we've had 3 cases. They're all connected to travel to Wuhan. In the other countries, the vast majority are connected to Wuhan. Maybe one of the cases are connected to another area in China. There are currently 2 countries looking at their cases right now, Japan and Germany, where there's been a very specific case of someone who has not traveled but contracted the virus from people from Wuhan. So in those countries, it suggests that even though they did not travel, they were in direct contact with someone who did come from China, and those instances are rare and very limited. For sure, in the general population in Canada, the risk is low.
Merci.
Thank you. You said earlier, Dr. Tam, that when it comes to Canadian nationals who want to return, Minister Champagne announced today that measures were being taken in order to bring them back. If I understand correctly, we have to identify them. We have to know where they are, I would imagine. You're saying that the measures taken on the ground are sufficient. If I understand correctly your answer to Mr. Polewski, you're saying that we do not recommend a quarantine. Did I correctly understand you? For people coming back as we speak now, measures taken on the ground in China are sufficient for us to function on a strictly voluntary basis.
So, as the President had already indicated, those very specific processes are still being planned. But what I do know, given my communication with the World Health Organization, is that China is actually not letting anyone leave Wuhan, that sort of containment facility. Anyone who leaves, and that's extraordinary, they have screening, active screening, before they would ever let anyone on a plane. That is because they're actually not wanting to let anyone out of the city. And so that there are actual strict screening before anyone can board a plane and leave. The rest of the very specific processes we are undertaking is still being planned. But from a public health underlying principle is that we have to assess the individual risk, I believe. Maybe they're not all the same. So I think some of it does take some detail, sort of detailing on the individuals who are potentially on that plane. What I'm talking about, of course, is the measures that we have right now for any traveler coming back from the affected area, which is we isolate the people who are ill with the respiratory symptoms. Their contacts are then monitored, and that is the sort of quarantine, if you like. Anyone who isn't sick that comes in do not get quarantined if they haven't been in contact with a case. So that is the general public health protocol. And so we will be sort of leaning on that as part of the guidance as we examine exactly what we're going to do with passengers on a potential flight.
Thank you, Mr. Delio. We'll now go to Mr. Davies, 6 minutes.
Thank you, Mr. Chair, and thank you to the witnesses for being here on short notice. Dr. Tam, generally, as close as you can, among those infected with the novel coronavirus, what percentage of patients have experienced severe disease?
So based on data coming out of China, it's been about 20% of what they define as severe. That could be pneumonia. But we know that in terms of the number of deaths, it's been just over 130 out of over 6,000 reported cases. So we actually currently cannot estimate the actual case fatality rate. That actually takes time, and other outbreaks can take weeks or in fact months to ascertain. But I think the world's global response is taking it as though it's going to be potentially serious. So I think that's where we're at, is about 20%.
Okay. And is 133 deaths of 6,000 cases, is that a high percentage of deaths in relation to the number of people who are infected?
So relative to something like SARS is lower. But as I say, there's 20% that might be in a serious, have a serious illness. So we don't know what their clinical course is.
Okay.
So I think that is what we are watching really carefully.
Thanks. Generally, how long is the period between when a person gets infected and when they start exhibiting symptoms?
So that is what we call the incubation period. And it seems to be a whole range, anywhere from 1 to 14 days. But the majority, and that number is sort of recalibrated every single day, right now is estimated at around 5 to 6. That's been the general incubation period. But you will have some outliers who are particularly long. And in Canada, we've taken the longest incubation period, 14 days, as a matter of how we pursue our public health actions.
Okay. I'd like to drill in to understand, if I can, exactly how this evacuation is going to work in China of Canadians that are there. I've heard there's something like 160 Canadians who have indicated they want to return. Am I to understand, and is Canada going to do any testing of those people to ensure that they are not infected with the coronavirus before they get on the plane?
So, as I've said, the details of that is being worked out. However, the Chinese authority will not let anyone who might be infected on the plane. The rest, we will be reassessing the protocol.
Can I drill into that? So, is there a definitive test for people who are who might be infected with the virus but are not yet symptomatic? Is that the kind of test you're going to have on people?
I think the protocol of testing those passengers is still, all of that is still being worked out. In China, they do have the diagnostic tests. No cases and no sick people will be leaving that city.
You read my mind. That's what I'm trying to establish. With an incubation period of as long as 14 days, how do we ensure that people that are getting on the plane together don't have the coronavirus, but they're not yet symptomatic? Can we definitively ensure that that is not going to happen?
So I think the protocols and the processes will be put in place that ensures we don't impact the Canadian public. But should anything even happen on the flight, there are measures to separate anyone who suddenly develops symptoms, for example. So those are still the things that we will be very meticulous in how we work through all of those processes in order for us to ensure that Canadians here are protected.
Do you know when the plane is scheduled to arrive in China and bring back the Canadians?
I think, Mr. Chair, all those details are being worked out, and obviously the Government of Canada is engaging closely with Chinese authorities in relation to working out some of those details. And from the point of view of the earlier questions that you were asking, I can assure all committee members that we're very conscious of the concerns that exist around, the potential for individuals to return to Canada and potentially, be asymptomatic and then subsequently symptomatic. And that is, all of those issues are being taken fully into account as we develop and operationalize how we would actually ensure that we, again, meet our obligations pursuant to the Quarantine Act around preventing the introduction and spread of communicable diseases into Canada.
If I might, I'm also concerned about the other patients on the plane.
Well, I was going to say, right. And of course, the concern also includes not just Canadians here, but the Canadians that would be returning on the plane.
Thanks. One quick question. Given that there's no specific antiviral treatment recommended for the coronavirus yet, I'm curious what treatment options are available right now to infected patients, and I guess follow-up, do you expect a vaccine for the coronavirus to be developed in the near term, and if so, how long are we away from a vaccine?
So the current medical treatment is supportive care. So So that is what's available, as it is for many respiratory viruses that don't have a specific vaccine or treatment. And so, obviously, medical care for if someone has pneumonia, you may need to support them with oxygen, or if someone is really severe, you may need actually ventilation. So, hydration and making sure someone can recover from the illness. There is an international collaborative effort to look at what the clinical course is and what kind of treatments might be actually important. The world is scanning every single antiviral that we already have that is available to see if it has activity against this particular virus, and that is a global collaborative approach, and the WHO is coordinating a lot of that as well. In Canada, we are pulling together our research organizations and our academic expertise in order to contribute to that global effort. So that's on the treatment or the antiviral side. On the vaccines, there have been a number of vaccines that have been previously developed for coronaviruses, not this specific one. And the world, again, is pulling together everyone who actually has one of these vaccines and seeing what we can do to accelerate the development. But what I can say is that even with the most rapid acceleration, I don't believe we are going to see a vaccine that is ready probably for a year. So at least we have to plan for the fact that we're going to be managing this particular virus with no specific vaccine.
Thank you, Mr. Davies. We now go to Monsieur Paulus.
Merci.
Thank you, Mr. Chair. 5 minutes. Oui, merci. Yes, I'm surprised by various countries who have taken significant measures to control the situation. If I'm understanding you right, we're taking some measures, but we have to wait to get papers out of the boxes and reactivate protocols to be ready in order to request the implementation of the Quarantine Act. Can you explain why in Canada it always takes so much time when we had recommendations from SARS 2003? Why is it moving so slowly?
Madame Yamnuski.
So, Mr. I want to make it, attempt to make it clear. We, working very closely with our partners, including the Canada Border Services Agency, are implementing the Quarantine Act across the country at every single port of entry. We're doing that now. We've been doing that for some period of time, and we'll continue to do that into the future. And we're very focused on ensuring that we're meeting our obligations pursuant to the Quarantine Act. So if I left the impression that we're not doing that, that is not the case. We work quite diligently and closely together to ensure that, again, we're protecting the health and safety of Canadians, and that we're looking, because the Act very much aims to prevent the introduction and spread of communicable diseases. And that is a role that's played every single day at every single port of entry.
I understand, and I don't want to attack your work, but we're here to ask questions because the public has questions, and we don't want to create a panic. We just want to know if the government is ready to react. You mentioned that at points of entry, specifically 3 airports, there are signs up to tell people to present themselves to an officer. But with flights coming specifically from China, why aren't there tests performed directly? Why don't we have the tools that other countries do? At the airport, in the hallways, I believe there's no way of funneling them into a different hallway. Everybody's in the same place. Is there any way of reinforcing these measures?
Again, from the point of view of the efforts that we have in place with our colleagues with the Canada Border Services Agency, they're very aligned with actually what's happening in other countries as well. And from our perspective, at the end of the day, the efforts are very much focused on controlling the spread, the introduction and subsequently the spread of the novel coronavirus. And the type of measures and the enhanced measures that we've put in place, from our perspective, are very aligned with what our key allies are doing.
Okay.
So I think at this point
merci.
we're quite
Je vais
satisfied
j'ai
with that.
seulement 5 minutes. Vous avez mentionné
Pardon me for interrupting. I only have 5 minutes. You've mentioned that 99% of passengers from the flight 311 had been met. Are we only talking about passengers that were close to them? Is it the whole plane? No, it's not the entire plane. It's not the full complement. We have a protocol regarding what will be done when we need to do something when it comes to contact tracing. The protocol indicates
really a focused concentration on individuals that are and rows that are around the index case that we're interested in. So it is not a protocol, again, based on the science and what we know about the disease that would have us look at contact tracing for everybody on the plane.
Merci. Vous avez également parlé.
Thank you. Let's say we have people who arrive, they don't have symptoms, and you mentioned that there's some people who might not be able to, in the different provinces, would they be able to check adequately for the virus?
Between the federal government and all of the provinces and territories. There's been a lot of work that's been done to ensure that there is agreed upon guidance in terms of infection prevention and control measures that are utilized in hospital settings, and guidance around what should be done in the event that there's an individual that presents themselves at a health facility indicating that they've been in Wuhan, for example. And that work has been underway for a number of weeks. And from our perspective, it's very clear that there's commitment across the country at a provincial and territorial level to ensure that we have a consistency of approach and that cases are addressed in a way that, again, ensures the health and safety of Canadians. And in that respect, from what we've seen to date, the system is definitely working as intended. And in terms of an individual that, may come through an airport that has indicated through the kiosk questioning, for example, that they've been in one of the affected areas. And as I've said earlier, the questionnaire now asks about Hubei province, not just Wuhan. We're providing them with information so that it's very clear to the individuals that are leaving the airport about what they should do in the event that they feel that they're becoming sick or concerned about their health. And that has played out as has been anticipated.
Thank you, Monsieur Paulus.
Merci. Thank you, Mr. Paulus.
Thank you, Chair. Thank you all for giving us valuable information. And Dr. Tan, thank you for your leadership. I have heard about self-reporting. How are you ensuring that the information that gets to the traveler, and I heard you set up 1-800 line. Is there any language considerations that are happening there? How the travelers are getting the information?
Through the as travelers are entering the airports, the 3 international airports, the information is provided in English, French, but also simplified Chinese. The kiosks themselves have 13 languages. And then the handouts that we are providing has French, English, and simplified Chinese. Just to say that the handouts not only will talk about the symptoms and what people should do, it certainly includes for calling ahead to your health provider before you present to like an emergency room or in the ambulance service. There are numbers at the back of that form for each jurisdiction so that they know who to call should they experience symptoms. That's to ensure they do not walk into a clinic or hospital and contaminate the environment. All 3 cases that we've had so far have entered the health system in a very safe way, where all infection prevention precautions have been undertaken.
If I understand, suppose a person arrive, one of our airport, you said the 3 airport people coming there, and they have symptoms of virus. Would they be experience? How would isolate it? You said the Quarantine Act, is that we can start from airport, or what the system we have in the hospital? How a Quarantine Act is working in the hospital, or it starts from the airport?
So at the airport, if someone was exhibiting symptoms, they would immediately be separated from the rest of the people in the airport, whereby the public health agencies staff will be doing an assessment, and the next thing they will do is send them to a designated emergency room for an actual assessment, should that be necessary. So there'll be the individual patients, if we take another history and they have symptoms are compatible with the illness, they will be sent to the emergency room. The transportation will be appropriately, whether it's the paramedics and the hospital emergency room will be alerted ahead of time so that they take necessary precautions. Once a individual has passed the international border and is into the local jurisdiction, it is their responsibility through local, very powerful local public health acts, where they can isolate cases and quarantine individuals. So that will be done by the local public health.
Thank you. Misinformation spreading on the social media, how we can avoid that?
I think that is the challenge of our day. So I think our approach is to try to provide that consistent, credible information through different channels. That's sort of escalating, of course, as we speak. The website that we have providing regular technical briefings and having that 1-800 number. But it is actually quite a challenge, and we have to try and improve sort of very broadly Canadians' not only literacy in terms of health and what they can do to protect themselves, but really is almost social media literacy, and you cannot believe every rumor and everything that you see. There are, of course, some elements of the social media environment. I've been working in the sort of vaccine confidence sphere, where you do have to actively sort of look for misinformation and actually address it. So I think that's some of the parts of the strategy as well. But it is of considerable significance, because as I have always said, the epidemic of fear could be more difficult to control than the epidemic itself. So I think everybody needs to do their part to try and address that.
Thank you.
We go now to Mr. Kitchen, 5 minutes.
Chair, and first of all, thank you all for what you do and the great work that you're doing and stepping forward here. We haven't seen this for, as we were all aware, with SARS, et cetera, for quite a while. So it does come forward. And so I appreciate the good work that you do. And we want to find out, because there will be people watching this show, and we want to make certain that Canadians understand the level that they're at and to educate them at the same time. And that's one of the things that we want to make sure we get out of this, and I appreciate that. Ms. Nemanowski, when your answer to Dr. Pawlowski, and he's asking about self-isolation, you indicated there were protocols that you have in place on how to do that. Can you share those with this committee such that we can understand that, so that we can see that, what those protocols are and what those steps are? Is that possible?
Do you want me to share them now?
No. I mean, in writing. I mean, I assume you've got them in writing, because it would be for you, plus you would hand that down and disseminate this. So is that possible?
Yes, Mr. Chair, that's possible.
Okay, thank you. in my practice many years ago, and before I became a member of Parliament, at times I had patients that would come in asking me about SARS, etc. And so I know if I was in practice today, that same thing would be happening. And so we want to make certain that we're able to reassure Canadians that while there is an issue here, we're talking about a virus. And we're talking about a virus, as you're well aware, that at this point in time appears to be low risk, but it is there and we need to take the proper steps. It is flu season. We need to make certain that we're doing the proper things that we need to do. And I think that's important. But if you can help just educate Canadians on where we're at on this, because the reality is we're looking at a droplet that's being exposed, and then there's a question of exposure to that droplet and then incubation time, correct? And as we see that, the question is that droplet. What is the lifespan? Do we know at this point in time whether that droplet lies dormant, or is it actually expires after a certain? So that you can explain that to people?
So it is correct that the current understanding of coronavirus in general, and we believe with this one, is that it is spread through droplets that people cough or sneeze out, but also if contaminated surfaces. So if someone coughs up a droplet is on this table, it depends on what surface is on. And so I think that the survival of the virus on different types of surfaces are probably being worked on right now. But viruses can survive for a number of hours on a surface. So, but there's a lot you can do. It's like other respiratory viruses where washing your hands is absolutely critical because you're touching all sorts of things all day, and it doesn't matter whether it's a doorknob or your table, is that is something that people can actually do. And so, and of course, to stop droplets and sneezes is, of course, if you're sick, please don't show up anywhere. Don't go to work to protect other people, but also cover your cough. That's really important to protect everybody. But like other respiratory viruses, even though it's new, we know how you can protect yourself against a respiratory virus. And those are some of the really sensible things that you can do. But it is true that it's not just the droplet directly from someone else, but it can land on the surface. And cleaning and disinfection is also appropriate as well.
Great, and that brings me to my next question, which would be, I recently, as of Friday, came in from internationally and landed in Toronto. And as we came into the international airport, we're walking through the airport. There's multiple planes that came in at the same time, and we all come to that very first point. And my first question, and I believe it's changed, but the reality is the screening so that people can actually see documentation on talking about this issue, which when I came through was not very evident. I understand it's got bigger and that it's so people can see that more. But it then brings me to the issue of, as they come through, people come to the computer where we start to punch in numbers. And we're touching basically a computer program that someone may or may not have put that droplet on. And so as that goes through, there's a concern about that, and I'm hoping that you've looked at that issue and how you are going to advise that, because as it gets forward, as you mentioned, the next step is then to go to the custom officer. And I noticed that the custom officers are being protected, and rightly so, and they're being so with masks and facial masks that are actually protective instead of the simple surgical mask that we see, because that, as you know, the lifespan of that is very short. But the reality is, what orders are being given to those CBSA officers to identify that? Because as I went through that, I was scared, not about this issue, but just so many people and so much confusion that where would they go from it? How are they going to? So what authority are you giving them to make the decision on whether someone is sick or not?
So the CBSA officers have been trained by our agency's quarantine service, so that's very important. But they are directly authorized through the Quarantine Act because they are the first screening officers. So they have authority, and they then have a reach-back mechanism also, should they be at all concerned about anyone, to our staff. who can then manage the situation as appropriate.
Okay, thank you, Mr. Kitchen. We go now to Mr. Kellaway. 5 minutes.
Thank you, Mr. Chair, and I want to thank you, the three of you, for your service and leadership on this file, and no doubt many others. We talked about today the importance of this committee and this discussion around awareness and around education. And if you could you unpack the terms presumed cases and confirmed cases for us?
Mm-hmm. So we, again, in collaboration with the provinces and territories, have case definitions. At the beginning of any emerging infectious disease, we have to develop the laboratory test. So now we have that. At the beginning of any outbreak, not every laboratory can do the test, but they're beginning to acquire the testing capabilities. For example, Ontario has managed to develop a molecular test based on the sequence of the virus from China, and is a very good test. But we want to doubly check it in the reference lab in Winnipeg, the National Microbiology Lab. So what you will see is that they'll be called presumptive confirmed until they've had that second check. So they are confirmed. They are actually being treated as a confirmed case on all accounts, whether it's contact tracing or managing them. And until that second test comes back at the National Microbiology Lab, we will not call it actually confirmed. But as you will see later on in the outbreak, many more laboratories will be able to confirm, and we won't have to necessarily maybe send it to Winnipeg. But every confirmed case will be reported to the Public Health Agency.
Thank you so much. It is a question that has come from my constituents on terminology and common literacy as to what those terms mean, because it's very important to them. The second question, if a person were to arrive at one of our airports and they have the virus or are suspected of having the virus, I'm a visual learner, what would they experience and what would they see at the border?
So if you have any symptoms, so as you come through the border, first of all, you will be able to see those arrival screens saying, tell the border service officer if you're sick and you come from this area. They will go through the kiosk and have the screening question. When a flag comes up from that kiosk, the CBSA officer will look at that and say, okay, this is someone from an affected area. But in fact, they will screen anyone who's sick. That's the normal job every day, actually. So at that moment in time, they will ask the individual, and in fact, they're not wearing masks and suited up. This is regular CBSA officers. As soon as they see that check box, if you like, from the kiosk, and if someone has any symptoms or they say they've had symptoms, that individual will be safely escorted safely asked to distance themselves. And then as appropriate, there are areas at the airport where we can undergo further assessment as needed. The Border Service Officer will ask you to wait. They will be calling the Public Health Agency's quarantine service for further assessment. And then, if necessary, if you actually have symptoms, and we have a very low threshold, actually, for further assessing someone, a quarantine order for examination will then be put in place. That person will be safely transported to the emergency room, and we already have designated hospitals that have been collaborating ahead of time next to those airports, who will then receive the patient. And that person will then be assessed by the physician in the ER, and then, depending on what they find, they'll be appropriately managed.
Thank you so much. Just a follow-up to the threshold of assessment. Can you break down the threshold of assessment, probably in 2 minutes or less?
We will be looking for anyone with a reported fever, cough, or difficulties breathing. Those are the
thresholds.
Really key ones. Yes.
Thank you so much.
You have 28 seconds.
That's a first time for a Cape Bretoner to talk less. But I do have some other questions here with respect to, again, around definitions and around terminology. So I hear, the risk to Canadians is low, and you've mentioned it several times today. Can you unpack that again around the terminology of low? Because I think it probably ties into a lot of what the previous answer referenced.
Yes.
Thank you.
So it's on the broader scale, because it can get very technical. The risk is obviously very high in China, 99% of cases in transmission. We have had, not unexpectedly, some imported cases that have been well managed. And so what we look at is the likelihood of importation by volumes of traveler from an affected area, and followed by essentially looking at the impact from a severity, but also looking at impact for, do we have the measures to mitigate the impact? So there's a balance of all of those things. So right now, the cases are in China, very few exported. Yes, there's human-to-human transmission, but those are generally for close contacts. The severity of illness, there are some severe cases, but the deaths have occurred in older people with underlying medical conditions. And so with all of that pulled together, the general public who has not been to China, the general public, the risk is low in Canada.
Thank you so much.
Thank you, Mr. Kelleray. We go now to Monsieur Thériault once more, 2.5 minutes.
Combien? 2 minutes et demie. Okay.
2.5 minutes. Okay. Earlier, you were talking about traceability, that the very first cases were carefully followed, the passengers in a certain circumference were monitored to avoid propagation. Now, this traceability, the traceability of these people, how quickly is this done? We identify them, but the follow-up is done over what amount of time? It's possible that they're asymptomatic. Is it during the incubation period? Do we follow them afterwards? How is this done in real terms? How has it been done? Because it was done.
So the expectation for any contacts is that they be actively monitored for 14 days. So that's the incubation, the longest incubation period that is being observed. It is local public health that will monitor the contacts, and it generally involves public health every day having some contact with that, with the individuals who have been identified.
Okay, mais est-ce qu'ils...
But were they put under quarantine for 14 days? Are they isolated? If not, do they go through different tests? Or did they do that as soon as the symptom manifests? What happens during those 14 days?
So there are different types of contacts. For example, if someone is an actual family member or a fellow traveler, they would have had much more close and prolonged exposure to the case. Those are the high-risk contacts. They will be essentially in a isolation or quarantine for 14 days so that you protect any further transmission. But other passengers, if you like, or other contacts will be followed up by local public health using their protocols. Right now, it is not necessarily keeping them sort of completely isolated. It involves active monitoring by the local public health departments.
Thank you, Monsieur Thériault. You have 2.5 minutes.
Thank you very much, and thank you to our witnesses. I'd like to get back to the point about the difference of opinion around asymptomatic situation versus what we understand, according to the media anyways. The health minister from China has indicated that you could be asymptomatic and still spread the illness or the disease, if you will. So I guess WHO is looking into this to try and get clarification. When do you expect an answer?
I think they're trying as hard as possible. But as I said, even if that is the case, what you have to, so there are two things that I think the experts will be looking at. One is, were they truly asymptomatic? Because they could actually have symptoms, so they will be looking at that first. Then, even if you have asymptomatic people that could transmit, is it just a rare event, or is it, sort of frequent? Because if it's rare, it's really the extent to which this phenomenon occurs. So that might take some time for it to be looked at. But we know coronaviruses, and coronaviruses or many other viruses, even if you sort of infectious at the start of your illness, you don't really readily transmit. It's when you're coughing the virus up, because it's a droplet spread, right? So you're coughing, you're sneezing. You're much more symptomatic when you have, you're much more likely to transmit when you have symptoms. So I think basically what we're looking at is not just, does it happen, but is it just a very rare phenomenon? And understand the extent to which this occurs. But we do know that asymptomatic people are not what's the key driver of epidemics. So that's very important to understand.
The other question, if I may, just very quickly, I know that Wuhan is the epicenter. The second source, from what we understand now, is Guangdong province, and from China in terms of people with the virus. So I'm wondering what plans do we have by way of the government in supporting the people who might be in Guangdong province, Canadians who might be there visiting over the holiday season and trying to make their way back? Is there any process in place with respect to that? And then second, in terms of safety measures with respect to that. I raise this because in my riding of Vancouver East, BC is the twinning province of Guangdong province. We have many of my constituents who travel over to Guangdong and may have had contact with people I don't know, and maybe trying to make their way back. And I'm just wondering, I'm very worried about them, both their situation there and whether or not they've been exposed, and then if not, and then for them to be able to make their way back. So I'm wondering from the government what actions is being taken in with respect to that. And then lastly, for people who...
We're at 3 and some minutes, so...
Oh, sorry. I can finish?
Just
finish
really quickly.
Sorry, and for people who may not be from Wuhan, so for example, people who've traveled, let's say to Japan, to Korea, and other places who might have contacted the virus. So, so in terms of measures in those other secondary individuals, what plans or consideration is being undertaken with respect to that from the Canadian government's point of view?
Mr. Chair, maybe I could note that in relation to the question around, what might be planned with respect to repatriation, that's really a question that is better directed at our colleagues at Global Affairs Canada. I think in terms of the other question that's asked with respect to individuals that may have been in Wuhan, may now be in other parts of the world that would subsequently come home to Canada from a flight other than directly from China. The measures that we have in airports would still apply. We did have, we've talked about the measures that we put in place in Montreal, Toronto, and Vancouver. We've actually had a couple of individuals that have come through in a couple of other locations where they indicated they self-reported. They indicated that they had been in Wuhan at one point prior to their return to Canada, and the same sort of screening that's taking place in the three airports was applied. So it's the same. It's consistent across the country in the sense that again, referencing back to the Quarantine Act. That anytime you have a traveler that returns and indicates to a screening officer, all of our Canada Border Service agents are screening officers pursuant to the Quarantine Act. indicates that they're not feeling well for whatever reason, then as Dr. Tam has indicated, there's a reach back to our quarantine service. So that applies.
So thank you, everyone. Thank you so much to our witnesses, and thanks for
Point of order, Mr. Chair.
Yes.
There's still a few members here that I'm sure would like to have some questions asked. There's a couple on our side, and I know there's someone on your side over there. I'd like to at least have a opportunity for them to ask questions of these witnesses. I believe that would be about at least 3 more rounds. Again, the unanimous consent motions didn't have an end time. The clerk took it upon himself to put an end time on this. However, we would like to proceed until we exhaust all questions on all sides of the floor here.
I have some very serious questions that really have not been answered at all.
So what's the... Are the witnesses able to stick around longer? So how about we do one more round?
If we could until all questions are exhausted, I believe that's
pretty open-ended. Let's start with one more round and see.
Well, the unanimous consent motion had no end time, Mr. Chair. So if we could, I think again, treating the seriousness of this committee, we putting no end time on it, I think is appropriate this time. So I'm open to as we go along to assess it, but certainly don't want to just put a hard end stop on it if we're finding out details in the moment. So if happy to do it ad hoc as we go, but just to say one more round, I don't think we have at least 3 more questioners. So.
Mr. Fisher, please.
Also, Mr. Chair, and obviously this would be at the will of the committee, perhaps we would like to retain the ability to bring these folks back again sometime because this is such an evolving issue. I've heard an awful lot about where we are today, but this is evolving so quickly that we might have totally different information in a week. So we could do it on a case-by-case basis if the committee so deems.
Yeah. Any other comments?
Yes, I have a comment. This is an emergency situation here right now. We have this special meeting set up here today to get some questions answered. We've got the presenters here today, and oh, you agree? Okay, fantastic. All right, well then, anything more to say?
In addition, to be able to have them back.
Yeah. Okay.
So. We have already proposed that we continue these briefings next week. In that regard, I don't know if you've seen the witnesses Ms. Sadu had suggested. She will share them with the clerk, and the clerk will share them with everyone. And if you have any further witnesses you want to put on the list, I'll work with the clerk to try and arrange their presence as we can. I'm reluctant to go wide, like open-ended on this because I don't think it's fair to our witnesses. But let's start with one more round and see where we get.
The only thing with that, sir, is that, or Mr. Chair, is that some of us won't be able to ask our questions. Can we make sure that everybody gets a chance to ask their questions?
Well, you'll get, if one more round, we would have 2 Conservative slots and 2 more Liberal slots. And the Bloc and NDP. Okay, so we'll do one more round. How long the minutes? 5 minutes.
5. Okay.
Starting with Conservative Party, Mr. Weber? Okay, go ahead.
All right. Well, thank you, Mr. Chair, and thank you for being here today. And I apologize, Ms. Nemanowski, if I wreck your name. Actually, I'm curious how you pronounce your name. But
if I do it the way my father would suggest I do it, Mr. Chair, it would be Nemesniowski.
Nemesniowski. I'm not even going to attempt that. Anyway, thank you for your presentation. You had talked about travel a bit, about the concerns about international travel. You said to check with travelgc.ca, and so I went online, and of course, China here. Avoid non-essential travel to China. The Hubei province, again, avoid all travel. Are there, in fact,
Canadians still traveling over there currently? I know that is a difficult question to answer, but are you hearing of people still traveling over to these areas, Canadians?
Mr. Chair, I don't think we would have information that would enable us to answer that question.
I didn't think so. I thought I would try anyways. But there is certainly a concern with people traveling over there, and many are suggesting that we implement a travel ban. Others say it's not necessary right now, and it sounds like that's what you are saying in your Department of Health. Who determines? Can you answer that question? Who determines whether or not there would be a travel ban put in place? What are the thresholds that are needed before a travel ban would be implemented?
Maybe I'll ask my colleague, Dr. Tam, to answer that question, because there's definitely an expectation that the World Health Organization has of countries with respect to imposing restrictions on trade and travel.
Mm-hmm.
Yes, so again, the WHO International Health Regulations Emergency Committee will meet tomorrow.
Okay.
They will have some recommendations.
So you will go based on their recommendations then?
Not just that, but if we go beyond, let's say right now, there's no, WHO does not recommend travel bans, and any measures that a country is to take must not be out of proportion to the risk, and must not inappropriately impact travel and trade. Okay. So we are signatory to the international health regulations, and will be called to account if we do anything different. There are on the global affairs side, that's you can ask them, because some of the criteria is more for safety, security reasons rather than health. So that is a different reason, because of some of the extraordinary measures, in fact, that China has put in place to try and contain the spread. We've never seen this type of extraordinary measure in modern public health history. And if you put everything on a standstill, you have to look at what the implications are.
Yes. Okay. Any indication, any idea of other countries who have put a travel ban in place? Do you know?
Not sure about countries, but I think there are 3 areas, such as I believe Hong Kong Special Administrative Region, for example, has put to the block.
Okay.
But I believe there's like 3 jurisdictions.
Okay. Another question I have, you talked about the confirmed cases, 6,000 in China, 133 deaths in China, 5 confirmed cases U.S. and 3 here now. Can you describe the demographics of these cases at all? Are they, is this more susceptible to, women or men, or is there an age there where they're more susceptible, old or young? Any indication there?
Well, there's been very few imported cases. Overall, in terms of the sort of 100%, if you like, of the cases, I don't think there's a very specific male to female ratio of note. At the beginning, there was, when it was linked to a specific cluster in a particular market. There was a male preponderance in the cases, but I think right now, not specifically. But in the severe end of the spectrum, there's more people who are older and with underlying medical conditions. So that is a key observation.
Okay. Great. All right. Thank you.
You have a few more minutes.
Just to add, though, about the exposure cases, most of them have actually been relatively mild. There's only been one exported case that had a severe outcome.
All right. I guess if I have a few more minutes here. Actually, can I share my time with Tamara here, and then she continues on the next round, so we can use those minutes. Sure. Go ahead, Tamara.
Okay, so I was receiving many messages, and it's actually from a number of concerned parents whose either the parents are permanent residents, the children have traveled across the water. Let me just kind of read one of these for you. A mother here in Canada contacted me about her husband, who is a permanent resident, and her 2.5-year-old daughter baby, Serena, who's a Canadian citizen, and they're currently in China, the father and the daughter. Her husband is hospitalized with a suspected case of the virus, and her daughter is in quarantine, though showing no symptoms. The government isn't giving any answers to some really serious questions. I've had many people ask me this first one: will permanent residents be eligible to get on that plane?
I think, Mr. Chair, again, that's a question that we can't answer, and that would be, I think, better directed to our colleagues at Global Affairs Canada, who are the ones that are having, the discussions with Chinese authorities.
So there's no, you guys have no clue on that one. Okay. Next.
Actually, time's up. We'll go now to Mr. Fisher, 5 minutes.
Thank you very much, Mr. Chair. And folks, thank you so much for this. This is incredible. And not just what you've done today. Thank you for all that you've done in the last few weeks. Dr. Tam, I've heard your name 1,000 times in the last few weeks. So thank you for the transparency, the information as it evolves. And I appreciate all that you've done. You talk about all of the collaboration, engagement with PTs, your FPT advisory committee, the minister's constantly engaging with her provincial counterparts, and also us contributing to the vaccine efforts. What are we doing differently or additionally than other countries, or are we following? And I appreciate that you're a special advisor to the World Health Organization. Are we doing anything different in Canada? Not since SARS, but are we doing anything different than the rest of the international world is doing to protect our citizens?
I think we're very much in line with similar countries. Right now, the World Health Organization is particularly worried about countries without capacities, particularly in the African region. And so I think the assessment of the WHO, whether it considers a public health emergency of international concern, isn't necessarily focusing on countries that have capacities like Canada. They have to look at the whole world, including countries that don't have the necessary capacity to prepare. We've been preparing since the beginning of even hearing about this outbreak and have all these protocols. So I think that I would say we're commensurate with countries that are similar in terms of health capacities, but of course a lot better than some of the other countries, which I think collaboratively, globally, we have to support, because a global containment strategy only works if every single country is part of it and there's a cohesion in how we respond.
Are you happy with the collaboration you're getting from China as compared to maybe in the past in 2003?
Well, I think obviously we actually collaborate as part of the WHO and the member states. What we have seen, and given my close communication with WHO, is how impressive they are, and how impressed they are by the work of China. The astoundingly rapid way in which they try to get a handle on what it is that's causing the outbreak and giving the world the sequence of the virus was very helpful. They've been providing information about cases which is extremely, extremely helpful. But even the fastest and of countries still needs a bit of time to actually digest some of this information. They have been open to WHO and an international team to support and to essentially look at what's actually happening. But you've seen the incredibly extraordinary measures that China has put in place to try and contain within its borders. And so even if this virus is capable of transmission from human to human, as I say, 99% of the cases only in China, not that many, like 1% is outside. So they keep really trying very, very hard. So I think that's our I think we have to be very supportive of the efforts.
Excellent. I was surprised and happily surprised when you said Ontario now has the ability to test, and we're using obviously still using the National Microbiology Lab in Winnipeg as the true tester. But will we get to a point where others other than Ontario, and will we get to a point where we won't need to use Winnipeg's results as the true proving point?
So we have
determining within Canada the ability to test.
Well, I think after SARS, we have many, capacity being put in place. One of them is the Canadian Public Health Laboratory Network that involves all the provinces. So there are provincial laboratories. I think our end goal, if possible, is as many of them as possible can do the test, because you need to be rapid. Sending a sample to Winnipeg takes a bit of time, even if we run it really fast when we get it. So I think some of the provinces, such as British Columbia is the other one, they did a very rapid testing.
Super.
And part of it is they actually sequenced the whole genome overnight. So we know they can, and other jurisdictions can as well. Eventually, though, there'll be even much broader, maybe even commercial test kits that laboratory can use that can rapidly identify as well. So that's the research efforts.
Do I have any time, Mr. Chair?
No, you burned it all up.
Thank you.
We go now back to Ms. Jensen. Ms. Jensen, you have 5 minutes.
Sorry. So just trying to figure out the situation that we have here. I have residents reaching out to me, another family, little baby Grace Tan. She's 1.5 years old. She went to Enshi with her grandma, who is she has no other family there, and she's a Canadian. And what we're trying to figure out is how can she come home with her grandma, because her grandma's Chinese. She's not a Canadian citizen. So we're trying to figure out, here's this plane, it's getting there, and I'm having all these children, they're minors as well. How do we get minor Canadians on a plane if we don't even know, details like, can a permanent resident go with them? So these are all like very, very urgent questions, and I'm not sure how we're going to get that communicated.
May I suggest these are questions for Global Affairs. These people aren't able to speak to that. We will be inviting someone from Global Affairs, I believe, next week.
So the challenge that I have with that is I believe the plane will be leaving before that. So how do I help my constituents and residents understand? Can a permanent resident go on the plane? How do you get a child, a minor, onto a plane without a guardian? Like what are we going to do for these people?
It's your question. I don't think they can answer, but.
Maybe I could just note that our colleagues at Global Affairs, there's been quite a bit of publicity about consular services, and for those feeling that they're in need of support from the Canadian government, I think our colleagues at Global Affairs have very much counseled individuals to be reaching out to consular services so that they will know and have a good understanding of what the need might be and the different individuals who are looking for support. And again, that's not something that falls within the purview of the Public Health Agency of Canada.
Yeah. So again, my challenge is these people are sending me these questions, and obviously they know they've even registered and so forth, and yet somehow or another they're asking me, can a permanent resident go? Well, how am I going to do this with the minor child and so forth? So there's a lack of communication. There's some wires aren't crossing, or they are crossing, and it's extremely urgent. That plane, from what I understand, is going to be there soon. We need to make sure that we do have good answers for these people.
Did the witnesses?
I can pass the rest over to my colleague. Is that all right?
Sure.
I still got some time here. Just very quick. Ms. Tam, you talked about the international global collaborative efforts with regard to developing a vaccination and, of course, exploring candidate vaccines. The work being done here in Canada is there's apparently scientists that are working on this right now, along with scientists around the world. Has there been more focus on getting more scientists here to work more on developing a vaccine, or are you relying on global efforts? Is there more money being put in here into getting scientists to work?
Well, I think this is part of the collaboration we're trying to pull together. So at the Public Health Agency, we are contacting other departments, and the Canadian Institute for Health Research, part of our health portfolio, is also part of this effort. So looking at they are actually looking at the researchers that we have here, but we do have to link with the global effort because of the response, of course, is mainly focused in one area of the world, and to be really, really fast, you actually have to kind of pull everybody together.
Surely.
But I know that there are a number of candidates, and there's a whole list of those. WHO's developing them, so that we expect to sort of link them into that global effort.
Okay, all right. More time, Mr. Chair?
You have 40
Mr. Kitchen,
seconds.
go ahead.
I'll just a quick question. When the report was done on learning from SARS, one of the recommendations that came out of that was the Government of Canada should ensure that an adequate complement of quarantine officers is maintained at airports and other ports of entry as required. That's a procedure that we put forward. Is that a procedure that's in place? And if so, have these been updated and increased at this point in time?
Mr. Chair, I think in terms of the question of procedures and protocols, we committed to provide information back to the committee, if that's what I understand the question to be.
Have we increased the number of quarantine officers since this outbreak has come about?
In terms of like just now?
Yes.
So we have a complement of quarantine officers, and we are thinking to the future about whether that we're in the process of ensuring that from a contingency plan that we're training additional staff in the event that would be necessary. But right now, the complement of our quarantine officers is able to support the measures that we've got in place and the level of effort that's been expended in terms of the border measures that have been described.
Thank you, Mr. Kitchen. We go now to Mr. Van Bynen. 5 minutes.
Automatic. Thank you, Mr. Chair. Being new into this, I'd be interested in knowing is if the World Health Organization does declare a public health emergency, what does that mean, and how does Canada respond?
So that's a very good question, and I think the WHO, of course, will have recommendations for countries that have the actual epidemic and then others. And they've already given some advice ahead of this. Canada is actually, so for other countries, not China, for example, the advice would be to prepare, to be vigilant, and to prepare to respond, to contain any imported cases. So in fact, Canada has already been doing all of these. I've sort of looked at the advice that was provided. Even though an emergency wasn't declared, there was some advice from the WHO already, and we're already meeting some of those recommendations. And so really it's about preparedness. So, and we've actually, as the President has just said, that we started alerting the jurisdictions as soon as we heard about this virus, and we've got all these protocols and capacity so that hospitals are on alert. I think that's essentially what the expectations would be. I'm not sure that there will be anything more that we would do, but we'll certainly be looking closely at what comes out of that meeting and see if anything additional needs to be done. As far as I'm concerned, we've actually been preparing for, I guess it's about a month now.
Mm-hmm. Okay. As a former municipal officer, when we had SARS, there was an important engagement both at the provincial, regional, and municipal level. And if I recall correctly, we had to designate a local arena so that people were able to attend for vaccinations once the vaccination was defined. To what level are those discussions going on so that as soon as we discover that there is a vaccination or something that can be done, that people are able to mobilize?
Yes, so Since SARS, but certainly learning from the pandemic of H1N1, but also our existing vaccination programs, we have a lot of capacity and protocols and already in place. So this is what public health does every day. But in our pandemic preparedness plans and our national, federal, provincial, territorial response plans, the vaccine response is a very major piece of the response that goes all the way down from actually acquisition of a vaccine. For example, for a pandemic of influenza, we actually have contracts and everything in place. There isn't a vaccine available, unfortunately, for this novel virus. Should there be, all of the experiences and processes and infrastructures that we use to get ourselves prepared for an influenza pandemic will be put to bear on how we do this. In the last pandemic of H1N1, Canada had the highest vaccination rate, I think, globally. So we have the ability to essentially, our aim is that should anybody in Canada wanted a vaccine at the time, we will be able to deliver it to them. But unfortunately, right now, that is not an option.
Okay, and I know that this has been mentioned earlier, but I'd like to get better detail on how are we better prepared to respond if there is a viral outbreak than in the past, like with SARS. So can you contrast our readiness now with the SARS readiness and how much further ahead we are now in our ability to respond?
So I think for any global epidemic situation, the international collaboration is key. So having the international health regulations and everyone sort of working under that umbrella and the WHO's leadership is very important. And they've strengthened a lot of that. You've seen countries that previously didn't have the capacity, like China, having acquired that capacity. In Canada, of course, the Public Health Agency didn't exist at the time, so we now have that. In Ontario, there's a Public Health Ontario. We've enhanced our laboratory capacity, our surveillance capacity, and so having this diagnostic done very rapidly was very important. We have this formalized federal, provincial, territorial coordination mechanism, and so that I can immediately contact all of my colleagues and set up the necessary processes to coordinate, because coherence and in response is really important. Otherwise, the public will be confused, the health system will be confused. So we're trying to be lockstep and be having a coordinated effort. I think the infection prevention control practices in hospitals is really important. The key to detecting an imported case is at that first encounter with the health system, taking the travel history and regular routine infection prevention control. So I think hospitals have learned that this is really important and have raised the capacity to do that. And then, of course, everything else, public health does very regularly is case identification, contact tracing, and management that you've seen Toronto Public Health, Vancouver Coastal Health, and others are doing right now. And I think, obviously having been providing information to the public on a regular basis, and I know that I take my role very seriously, and I'm going to try and communicate what I know, what I don't know, when I'm going to potentially be able to tell you in terms of new information is, I think, absolutely important. I think the fact that we had all the systems alerted in such a short space of time and picking up these cases and how well they've managed is a testament to how the system has improved over time.
Thank you. You're out of time. You're done. We go now to Monsieur Thériault. 2 minutes et demi.
Monsieur Thériault, you have 2.5 minutes. You spoke earlier of close collaboration between Quebec and different provinces. I'm wondering how this translates to action. If, and in Quebec there were only 6 cases of voluntary declarations and the results were negative, But if someone has a case, if they're a carrier, how long does it take before the entire system, the entire protocol, and the international community is aware? I would imagine that technically, scientifically, there's the detection of the case, but in terms of we have a case, is this done instantly? Does it take 2 hours, an hour, a day? How much time?
So right across Canada, I think the system is so alerted that we are, our local jurisdictions are investigating a number of people. They're assessing people who've returned from China very regularly. So anyone who then fits our what the case definition looks like, they don't have to wait for a test for diagnosis. They immediately already are put under isolation, and so you don't have to wait for the test. They are going to be managed clinically, and then the lab test. Many provinces can actually do at least the first step. So Quebec, for instance, will be able to test for all sorts of viruses, and maybe the first step of that coronavirus testing. That's critical. And then the transportation time, of course, to the National Microbiology Lab can take a number of hours, and we will run the test very, very fast, also within hours. But that doesn't mean that individual, the sick person, has not already been managed. So that's really fast.
Non, mais vous allez savoir.
In how much time? Let's say I say that I think I'm ill. Is it 5 minutes, 1 minute? Mr. Chair, perhaps I can try to answer the question. It's almost instantaneous.
Are very seized with the importance of ensuring that the federal government in particular is aware as soon as they think they have a presumptive case. I mean, we've been getting notification, at least in the context of the 3 cases, very, very quickly. As soon as they know, they're engaging us.
OK. Est-ce que c'est le cas pour les États-Unis aussi?
Is it the case for the United States as well? Because the border is... Thank you.
Very quickly.
Mr. Chairman, we are working very closely with our colleagues in the United States. We have daily calls with the CDC, the Center for Disease Control. Prevention and Disease Control, I think, is actually their official title. And they are sharing information with us quite quickly. In terms of, I mean, obviously, they have their own system. There's no obligation for them to tell Canada in advance of reporting to the WHO, but we're working closely together, so we're aware of what each other is doing.
Great. Thank you. Mr. Davies, 2.5 minutes.
Thank you. Dr. Tam, are there any countries like France quarantining people, their citizens in China for 14 days? That you're aware of?
I'm not. I don't think I can be absolutely certain about that. I think I think it sounds like the UK may be doing something like that, but
you're not sure at this point.
I think each individual country does have some variation.
Okay. Now, Dr. Tam, in 2005, you co-authored a study that found that, and I'm going to quote, "From March through May 2003, Canada introduced various measures to screen airplane passengers at selected airports for symptoms and signs of SARS. In spite of intensive screening, no SARS cases were detected. SARS has an extremely low prevalence, and the positive predictive value of screening is essentially 0. Canadian screening results raise questions about the effectiveness of available screening measures for SARS at international borders," end quote. In your view, Dr. Tam, are available screening measures for the novel coronavirus any more effective today than they were for SARS when your study was published?
So we know that entry screening, sort of into Canada, for example, can never be 100% in terms of stopping any. This is a virus; it can cross borders, but it is a layer of a multi-layered response. The most important layer, of course, is the initial entry into health system, and we talked a little bit about that. At the actual international border, I see it as a great opportunity to absolutely make someone aware of what to do if they're sick after entry. So in that paper, what I recommended was this is a moment in time. Someone is paying attention as they're crossing the border. You can give them the information that they need. It's a moment of education to what they should do if they get sick. What I did not find effective in that paper was thermal scanners. So that was a lot. We scanned, I think, 6.3 million people, both on entry and exit, and couldn't pick up a case. For very specific reasons, it's because of that incubation period, people can be asymptomatic. And for other reasons, this is just not, and that predictive value, if it's rare, you don't expect actually a case. It's actually not very effective. So that's the thermal scanning bit.
Yeah, which
not
we're not doing now.
We're not doing that.
Can I just
Yes.
I'll get one quick question in, unfair question maybe. We have 3 cases in Canada. Are you working with any modeling to project what the range of cases Canada might expect might be? And if so, what are those numbers?
So I think that there are models have been done in terms of flight paths and the numbers over January to March from Wuhan, for instance. So we have those numbers. But Canada's risk is much, much lower than many countries. So it's going to be rare, but we are expecting cases. So, but it doesn't matter how few those cases are, we are preparing the whole country to, in the event that you might pick up a rare case. So that actually is what we're doing right now, is preparing. It is going to be rare, but you're going to have some.
Thank you, Mr. Davey. And that brings us to the end, finally, I think. Thank you to the witnesses for your excellent and comprehensive responses to excellent and comprehensive questions. And as we progress, we may want to invite you back at some point, and I hope you'll be able to come. Thank you. So I'll remind everybody that we have a regular meeting. Regular meetings are starting Monday, 3:30 to 5:30, Wednesday, 3:30 to 5:30. Get your witness lists to the clerk, and we'll try and sort something out so we have proper witnesses as we go forward. And Ms. Guan?
Thank you very much, Mr. Chair. I'm wondering, too, in preparation for the next meeting, if the analysts can prepare some information for the committee members, including what the other countries are doing. So, for example, the question that was just asked about France in terms of the evacuation procedures, in terms of the UK, how many countries have embarked on putting forward a travel ban and so on. All of those kinds of information that is out there, we get it haphazardly, I would say. It would be so lovely for the committee members to get that information, factual information.
Okay, any more comments?
Just quick, can we just make sure ahead of time that the meetings are televised going forward on, I guess, for the Monday, Wednesday meetings as well?
Agreement on that. Is that you mean every meeting? I don't think we're going to have every meeting.
Sorry, just the Monday, Wednesday ones coming up here, so we don't have to suspend at the beginning of the meeting. Yeah.
Do we have agreement on that? Sure?
Yeah.
Okay.
When services are available.
When services are available. Yes, Mr. Davis.
Mr. Just quickly, I realize we're establishing the agenda. I'm just wondering when we will come back to our routine proceedings or the standing orders of the committee.
I'm sorry, I missed your question.
Well, we still have a little bit of unfinished business from the standing committee. I stood that down today, but before we get too far in terms of scheduling Monday and Wednesday, when is that going to be taken care of?
I will propose to the committee that we deal with your motions that we put off on Monday when we come in.
Or if the committee prefers, we can defer that to the latter half of the meeting, if you'd prefer. Maybe leave the last, I don't think it shouldn't take longer than about 10 or 15 minutes, I don't think.
Okay, well, that works.
But I'll leave that to the committee chair, but it's at Monday's meeting at some point.
All right, I'm dying to pound this hammer. So. Mr. Thériault.
Est-ce qu'il serait
Would it be appropriate? I don't know if my colleague, Mr. Davies, would want to communicate this. Perhaps we could go even faster if we have a copy that we've read ahead of time.
Yes, I'll be happy to circulate that to committee members tomorrow.
All right. Thanks, everybody. With that, we're now adjourned.